I went to an urgent care center because I had had COVID the previous summer, and I thought maybe it was something left over. I was short of breath, and I really didn't feel well. And they suggested very strongly that I go right to the hospital. I'm Carol Murray from Lakewood. About 7 months ago, I was diagnosed with stage 4 lung cancer, plus a tumor in my colon at Monmouth Medical Center Southern Campus. I was given all kinds of tests, and they said my one lung did not look good. There was something there that needed attention, and that's when I was admitted.
I saw her in the hospital while she was admitted to Monmouth Southern Campus for an oncology consult. And we confirmed that she had stage 4 lung cancer. We did a workup, including a PET scan. And while we were doing the PET scan, we found that she has a mass in her colon, which was suspicious for cancer.
I never smoked. I never had any bad habits health-wise. I was a distance biker, and I had always been very active, so it came as quite a shock.
When we found that she has a colon mass, I referred her to Dr. Boyan to see if he will be able to remove that mass surgically.
The normal algorithm for that would be to have her sent for a colonoscopy, which would be able to get a biopsy and a diagnosis, and then we could plan treatment going forward. Unfortunately, due to some different anatomy in Carol specifically or inflammation, the colonoscopy wasn't able to be performed, but we had a very high suspicion that this was a colon lesion that would likely be cancer. We were able to perform right colectomy, which is taking out the right part of the colon. We were able to do that laparoscopically, so she just ended up with 4 little camera incisions. We were able to do that at Monmouth Southern Campus. She received great care there and was home 2 days later.
When I was released from the hospital, I went to Dr. Esau's office, and she created a plan for me. I was to take a pill every day.
For the stage 4 lung cancer, the treatment is usually involving chemotherapy, but we sent Carol's tumor cells for further analysis, and we found that she carries a mutation in one of the genes called EGFR.
If you see that marker, EGFR, it usually predicts a better prognosis, meaning longer survival, better chance at cure, and it actually predicts a response to a specific treatment, a treatment that is called a TKI or Tyrosine Kinase Inhibitor. And those drugs can be pills that people receive that actually target that mutation, and it's a more direct treatment for the cancer.
From my personal experience, I have patients who had stage 4 lung cancer who have this mutation now free of any kind of lung cancer about 6-7 years later. So I'm hoping that Carol will have a similar outcome.
I'm feeling better, and I expect to make a full recovery. They treated me like royalty. Everybody that I met at RWJBarnabas was more than respectful and kind to me.